We will call the Committee for Health and Human Services meeting to order. Can we get a roll call, please?
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki.
Here.
Commissioner Dobb.
Here.
Commissioner Anderson.
Here.
Commissioner Killeen.
Right here.
Chair Baker McCormick.
Here.
You have a quorum present.
Thank you. Next item.
B, Chairwoman's remarks.
I just want to wish everyone happy holidays and Thanksgiving, and pray that we all are safe and eat good over the holidays, but not too much, right? All right, next item, please.
C, approval of the November 9th, 2021 meeting minutes.
Is there a motion?
So moved.
Move to a second or a second it.
All right, it's been moved and supported. All those in favor? Say aye.
Aye.
Any opposed? All right, motion passed. Next item, please.
D, unfinished business. There was none listed.
Okay, next item.
Item 1, under new business, an update regarding COVID-19.
All right, do we have Miss Baker here today?
Yes, good afternoon.
Good afternoon. How are you?
I am doing well. I'm doing well. Thanks for having me.
Good. And if you can send our prayers to Director Jordan. I know she had someone that passed away in her family. So, yeah.
I sure will. I sure will. And I'm bringing this update on her behalf today. My name is Carolyn Baker, Chief Operating Officer for the Department of Health, Human Veteran Services. May I have permission to share my screen?
Yes, go right ahead.
Okay. Is it visible to everyone?
Yes, it is.
Okay. I have 10 slides that I would like to share today. And I apologize because I shared some of this information this morning on the 43 communities, so you will hear it again. But I think right now, hearing this information repeatedly is important because we are, the cases are increasing. So with that, this report is for the period of, it's a 7-day period, November 14th through the 20th. Okay. And so I'll also provide some updates on the week prior to that when I'm presenting the positivity rate. But as far as new cases, over the past week, there were a total, let me progress my screen. There were a total of 5,387 new cases reported for Wayne County. And this is the confirmatory, based on the confirmatory test, the PCR test, and 5 new deaths identified. And so this is an average of 770 cases per day, new cases per day. This is a 48% increase in the confirmed cases from the previous week, November 7th through the 13th, when we reported 3,630 new cases. And this is a 90% increase from 2 weeks prior, and that was October 31st through November 6th, when we reported 2,833 new cases. So as you can see, we are increasing by 50% week by week, and we are monitoring this trend. Just looking back at the same time last year, we experienced the same trend during this time, and this is the flu season. And so we are anticipating, projecting that we will continue to see an increasing trend in the number of cases over the next few weeks. Cumulatively, there has been 136,000 760 cases reported since March 2020 and 2,900 deaths since that time. Based on our demographics, the mean age is 35.9 years of age, and while the mode is 11 years of age, and we've been seeing that mode reported for the past few weeks now. This is a table of the previous week number of cases by age compared to the last 7 days. And as you can see, there has been an increase in all age group other than 0 to 4. So looking at 5 to 11, this is comparing the previous week to this week. We see 297 excess cases, so more cases in that age group. For those 12 through 18, we are up from 422 cases this week, reporting 602 cases. This is 180 new cases reported this week, additional new cases. For the age group of 19 through 29, this week we reported the number of new cases reported 780 new cases, and this is up from 53 cases, and this is 227 new cases. There's also an additional 227 new cases, and when I say additional, I'm saying in excess of what was reported the previous week for the age groups. So 30 through 39, we also see 227 additional cases than what was reported. For those 40 through 49, we're up from 476 cases reported 2 weeks ago to 927. And this is 295 excess cases. And then for those 65 through 74, we're up from 227 to 351 cases, and this is 114 excess cases, and 76 excess cases for those 75 years and older. So we're seeing this this increase in all of the age groups. Percent positivity, we are in a CDC risk threshold of high risk, and we've been here for quite some time now. And high risk transmission is a positivity rate of 10%. So of those tested this week, our percent positivity rate is 15%, and we've been increasing, as you see here, the 4-week trend, on an increasing trend. And this is in alignment, although lower than the state. The state reported 17.3%. And prior to that, this is up from 16.4%, and then 13.7% the previous week, and 11.6%. The city of Detroit is also on an increasing trend, 7.8% reported over the past 7 days. And this is up from 6.4%, and then up from 5.0% and 3.5%. By municipalities, I'll report on the top 5. Dearborn had the highest number of cases reported with 555 cases and 10% of the total cases, followed by Canton Township and Livonia. Both municipalities had the same number of cases reported, 435 new cases, which makes up 8% of the total cases in Wayne County, followed by Westland with 365 cases, which is 7% of the total cases. And then Dearborn Heights with 357 new cases and 7% of the total cases. This chart presents our testing capacity over the past 4 weeks. So we're averaging 4,983 tests per day. And this is slightly higher than the state that is averaging 460 4,651 tests per day. In the city of Detroit, which is which averaged 8,002 tests per day. I'm trying to reduce this by a couple of hundreds. Okay, moving on to the next slide. So this is the K through 12 outbreaks. We are school-related outbreaks, COVID outbreaks. So over the past 7 days, there have been 10 new outbreaks reported and 18 ongoing outbreaks. And these are the schools. This data is actually reported on the state of Michigan website for all of Michigan. So you can go on the website although we have more current data than the state. The state is a bit lagging, but at least you can see the ongoing outbreaks listed by schools. The variants, we have 2,664 variants confirmed, reported for Wayne County. So we've been consistently increasing in the proportion of the Delta variant. So as of the past 7 days, 54% of the variant reported was Alpha, due to the Alpha variant, and 43% consists of the Delta variant. Over the past 7 days, 134 new Delta variant was reported for Wayne County, and no new Alpha variant was reported. Vaccine coverage. We are still making progress on our vaccine coverage for Wayne. If we look at the 12 and above population, that's the population we've been reporting on previously. And I also have the data here for the 5 and above, which includes the 5 to 11. So for those who received 1 dose of vaccine, 73.6%, and fully vaccinated residents of Wayne County, 67.7%. And this is above the state rate of 1 dose for 12 years and older, 65%. And then those who are fully vaccinated statewide, 60.1%. The city of Detroit, for those 12 and above, 48%. And those who are fully vaccinated, 40%, 40.3%. And we see this number slightly lower now that we began vaccinating the 5 to 11, and that began November 5th. And we're seeing that our fully vaccinated rate is 61.6%. And those who received 1 dose is 67.8%. We've been very active in, and let me go to the next chart that shows the rate by age, the vaccination rate. We have been very proactive in reaching out to the schools and scheduling vaccine events, especially those elementary and middle schools. And we have been getting good results with that. So 9.5% of those 5 through 11 have been vaccinated starting November 5th. And because of the time frame, we do not have any, it's 0% for those fully vaccinated. Those who are 75 and older, actually starting at 40 and older, have reached the 70% of vaccination national threshold, but there's still room for the fully vaccinated, and we see that trend is in alignment. It's just a matter of time in reaching that goal. So I do want to talk about the booster vaccine. So the CDC and the FDA have the FDA and then the CDC recommendation. All those 18 and older are eligible to get the booster vaccine. So there's no eligibility criteria there. And so we are still administering the booster vaccines. For our health department, we have administered 5,644 boosters shots. And then for all providers, serving Wayne residents, there's been 130,970 additional booster shots administered. I do want to just touch on the breakthrough cases. We are seeing a slight increase in the breakthrough. I've been reporting, and also Director Jordan have been reporting a breakthrough rate less than 1%. And as of the past 7 days, the breakthrough rate for Wayne County is 1.2%. The state have reported a 1.5%. So we're seeing a higher breakthrough rate, and we are monitoring that, and we'll be sharing that in the weeks to come. We're still administering the at-home vaccine, so residents can call to get their vaccines administered at home. To date, we have administered 472 vaccines. So this slide has all of our sites that are providing vaccines for those 5 to 11. So our Wayne Health Center, Wayne County Community Campus in Belleville, the community college at Downriver, and then the PEDS office, family doctors and pharmacies are all administering vaccines for those, for everyone, including the 5 to 11. And this is the phone number to contact our health department to schedule a visit, a vaccine to get your vaccines administered. So this concludes my report. I'll stop sharing my screen.
Thank you, Ms. Baker, for your report. As usual, it was very insightful and detailed. One of the questions that I have is in relation, I'm sorry, can you hold for 1 second? I'm sorry about that. Okay, so as I was saying that one of the questions that I have is in reference to increasing one's immunity or immune system. Is there any information that you all will provide or can provide the general public? And I'm not saying that that's going to cause them not to be infected or cause them not to, catch the flu or any of that. But it would just be interesting to know why we don't talk about preventative alternatives as a way to build the immune system. So I'm referring to like vitamin C, zinc, vitamin D, those types of things that I think could help to build your immune system. So is there any thought around that? And I know that's different, but I just think that is a way in which we can help our citizens to be healthier in the future as well.
Yeah, that is interesting. And I am curious to see what the CDC have put out there as far as building the immunity around COVID. I know that providers
and not just around COVID, but just in general.
The flu, the cold, all of those require a strong immune system can help. But we've been in the midst of this, really focusing on educating about vaccines. So, to make those large impact on the population level. And so that's where the health department have really made a lot of movement in making sure we get what the providers need, and to make sure that residents know where they can get vaccinated. So that's really our first line of strategy, promoting testing, COVID testing, and getting vaccinated. But that is interesting to see what other public health providers, such as the CDC, other public health department, have put out when it comes to that information, like from a clinical perspective.
Yeah. If in the future, if you have any information on that, I would just be interested in knowing if any other health agencies or health departments, if they talk to building the immune system. Thank you. That was my question. And I see Commissioner Dobb had a question as well.
Oh, Madam Chair, Commissioner Maraki had her hand up before me.
Okay, well, Commissioner Marecki,
Oh,
I just
okay.
saw hands.
Yeah,
Sorry
no,
about
no,
that.
that
Go
doesn't
ahead.
matter.
Okay.
Well, thanks, Carolyn, for this information. Just a comment, I'm still perplexed about the Detroit numbers when their percentages are much lower than Out County and their vaccination rates are much lower than Out County. So that perplexes me every time we are given this presentation. So if the breakthrough rate is 1.2% now, then do we have to assume that all these increases in cases are definitely people that are not vaccinated, have not been vaccinated?
Right, that's what the breakthrough rate represents. So if we actually take the number of COVID cases, we look at that, and then look within the data to see of those who are actually vaccinated. And so if we are not able to count that, then they're unvaccinated.
Okay.
So yeah.
So if it
the
rose up 15%, then 13.5 of that were unvaccinated, pretty much. You're saying, if the numbers rose up, so in that area, right? If it's only 1.2% that are breakthrough cases, then these are all unvaccinated people that are getting the COVID
a large
rate.
proportion. Yep, and that's what we are seeing nationally. And as we read day by day what's on the CDC's website, that's what they're reporting. I mean, so, and we have to be very conservative too. And as I mentioned this morning, we see variability across municipalities. We see variability across age groups. So this is like an average, right? You may see the breakthrough being higher among those 65 and older. You may see it even higher among those within skilled nursing facilities, because one, they were in the priority group, they're in a congregate setting. So there's a lot of factors around that. But when we look across our entire population, on average, across all age group, across all municipalities, across all risk population, that is where we are right now. And it's increasing, right? So we're reporting less than 1%. So that's an indicator that we really need to pay attention to as we're promoting getting your booster shot. So we really need to pay, and a lot of folks actually got their vaccines about 6 months prior.
Right. And I suspect that number might even be higher because people are getting breakthrough cases that they probably aren't even getting tested for. They might have a slight cold, they might have things like that, unless they're more severely ill. Okay, I think that's all I have right now. Thank you.
Yeah, that's a great point though, because asymptomatic, we know that until you get tested and get a confirmatory test, there are a lot of folks who are asymptomatic, which is why we're promoting and we're requiring folks to wear their masks because you can still transmit it and you can be asymptomatic, but still be exposed to COVID.
The one more thing too, I mean, these numbers, I have to look back on last year's numbers. As these increase though, our death rate is not like it was last year.
Exactly.
I mean, if you're saying there's 5 new deaths over the last week and we've increased from, what was it, 13% last week to 15% this week, with 5 new deaths, then that is different than it was last year, I believe, if memory serves. So, you know, with maybe the Delta thing isn't as severe as it was last year. So anyway, thank you.
Thank you, Commissioner Marecki. Commissioner Dobb.
Thank you, Madam Chair. My question is regarding the outbreaks in the schools. Do we have any, or is there anywhere we can look for data that compares outbreaks, the outbreak numbers by county throughout the state?
Yes, so the school outbreak numbers by county. So the state does have every school outbreak throughout the state. So to answer your question is yes. Now, I don't know if they aggregated by county. I haven't seen that. So you almost have to take that data and then add it yourself based on what I know right now. But it could be organized that way. But yes, all of the outbreak statewide is available. You can go onto the state's website and see the name of the school, see the number of outbreak to see if it's new, and they tell you the school district as well.
Okay.
Yep.
Thank you. That's all I had. Thank you, Madam Chair.
Thank you. Commissioner Killeen, Vice Chair.
Thank you, Madam Chair. And thank you for the report, Ms. Baker. When the CDC says over 10% positivity in the testing puts them in a high risk group, what do they mean by that? What is the consequences of that going forward? How does that help our public health officials?
So that has, it gives us data indicator for policies, for strong recommendations. So we're talking about community transmission, right? So when we're having low transmission, we're able to identify like outbreaks, whether it's through a party we are, or some baptism or some function, we're able to pinpoint that. Once the transmission rate starts to increase to high, that means it's widespread. So then we should start talking about policy implications, such as universal masking. Last year, some of the policy implications were shelter in place because we didn't know where the transmission was coming from. It was so widespread within the community. So these are the things that, and I see some school districts are taking precaution. I know the city of Detroit closed for the Thanksgiving holiday because they were seeing high number of cases in the schools. So that is just an indicator to say, okay, so what are you going to do now? By the way of ensuring that you're protecting residents, because we don't know, it's widespread throughout the community.
Okay, yeah. Do hospital systems use that as they look at how many beds they have and how many may be coming in the next week or two? Do the hospitals use the high transmission rate at all in their planning?
That's a great question. I'm not sure about that. I wish I had more information about some of the indicators that they use, but regardless of COVID, hospitals look at their bed capacity, their ICU capacity, as they service the entire population, and they're servicing multiple, they have to manage multiple disease and hospital needs. So they're definitely using the hospital capacity. And that has been a very strong indicator in the beginning of the pandemic, because without the hospital capacity needed, then we can't really help and support, right? So we saw that the state, took some really strong measures based on the hospital capacity and the transmission rate, but that's a strong indicator for policy as well.
Yeah, thank you. I'm going to go back to Commissioner Marecki's question on the death rate. And I don't know, we're right in the middle of this because I got another question I'm going to follow up with where we're still gathering data. My guess would be on the death rate that the hospital systems today just have that many more therapies in their toolkit and have learned these patients over time, that the kinds of things to treat the patients with were maybe a year ago patients would be dying at a higher rate, but now we have better care and we've learned a lot. Is there anything on that, Ms. Baker, other than anecdotal evidence in terms of the lower death rate and the ability of hospital systems has increased to treat patients?
So I wouldn't say it's anecdotal. We do have the data to show that the death rate is low. So lower than lower relatively, right?
But is that attributable to hospitals learning how to take better care when these folks come through the door?
Yeah, and so I wish Dr. Schmidt was here to give a clinical perspective, right. But from that view, but the thing with COVID is that, and I know you're speaking, you said that looking at the data and not speak anecdotally, but COVID is still so unpredictable.
Right.
So even though we haven't learned to manage it, right? The population now that we're seeing higher cases is of a younger population, less with underlying condition, even though that's, when we saw the death rates, that's what we were seeing in our nursing homes, in our congregate setting, those that had comorbidities as well.
Right, high risk factors.
Now it's widespread. We are seeing less death, but the thing with COVID, like I stated, it's so unpredictable. How it impacts you may be different than how it impacts someone else, regardless of age, right? So prevention is the best strategy, but we're learning how to better deal with it, and treat it, as you stated.
Well, it is a pandemic, and in some way you can almost think of this as a single organism around the world. Today, your numbers might be up, somebody else's is down. 2 weeks later, a month later, your numbers are up. Whoever had high numbers previous, their numbers are down a bit. When you look at what's going on in Europe, where it's raging again, where it had gone down for a while. So, it's worldwide. So everybody's going to have their turn, and you might be a little low now, but numbers go up or the opposite. Another kind of gray area, Ms. Baker, that I want to ask about, the data on long haulers. Is there, I would imagine there's a gathering, we're getting more and more data on long haulers and how many people are being affected by long haul. Is there really anything, any kind of studies or whatever, any kind of concrete information on long haulers and what percent of people are experiencing long-term consequences as a result, even when they're released from the hospital?
Yeah, I'm sure there's some studies out there. We're not collecting that in a surveillance-based process, but I'm sure there's some studies out there that can be pulled. I can look into that.
That would be interesting to have, whatever the latest is on long haulers, to start getting, because we're talking public policy again, to start getting handle on, how many is it, because we talk about percentages, right? Are we looking at 10% of the people? Are we looking at 10% of the people? Are we looking at 20% of the people? that have long haul symptoms and what they may be. So if you have anything on that, I would appreciate sending that along. And thank you for your report. And Madam Chair, thank you for the time.
Thank you, Vice Chair Colleen. And thank you again, Ms. Baker, for a very detailed, informative report. And we look to hear from you next time.
Madam
Thank
Chair,
you.
I had a
Madam Chair,
question.
I'm
Okay, go
sorry,
ahead.
I didn't
Go
see
ahead,
your
Glenn.
hand. Go
Go
ahead,
ahead.
Glenn. I didn't see your hand.
All right.
Okay.
Thank you. Yes, Ms. Baker, I just wanted to ask if you could go back to the slide about the outbreaks in the schools. And once again, if you would give us your assessment of that as compared to what has happened. Is it increasing? It certainly appears to me that it is over, because I don't see like a comparison of what has happened. I may have missed it.
Okay, so is your question, is it increasing over time? So just looking at the slide right here, these are the new cases, and I know it's so small, right? That's why I kind of passed and went to the next slide, but I have my number here. So these are the new outbreaks reported over the past 7 days. And then these are the ongoing outbreaks.
So when you say ongoing, is that for going back till what, late October? I guess what I'm looking for is a perspective, a comparison, something to compare. Are we getting better? Are we getting worse as far as the infections in our schools? And how much is that increase? If it's an increase or if it's a decrease, how much is that?
Okay. Yeah. So what I don't know is whether the ongoing is due to ongoing investigation, or when the investigation is closed, it's dropped off the list, and I can confirm that for our next report. And
okay, if you could do that, because we hear a lot at our meetings from folks that are against the mask for students, and I think the numbers belie that, but I'd like to see that comparison going back far enough that we can really see if there's a trend or not. Certainly hospitalizations, as I understand, hospitalizations of children have increased. And I think there was a report that I read that Macomb County had some of the highest numbers, which they do not have a mandatory mask policy in place for schools. So I'm just trying to see if the numbers back that up.
Okay.
But I appreciate if you can have something for us for the next meeting.
Okay.
Thank you.
You're on mute, Commissioner.
Oh, thank you, Commissioner Anderson. Did you have another question, Commissioner Marecki?
Yeah, thank you. Thank you,
Okay.
Madam Chair. And just reiterating what Commissioner Anderson just said, I would really be interested. I mean, we can go out to the state. I'm going to see if they have the counties separated. But I would really like to see us compared to like a Macomb County, see what numbers are going. Because, like I think it was Commissioner Colleen, this is all going to be cyclical. As we're moving indoors now, I mean, this is what's happening all over the country with the different, weather patterns as far as people being outside, people moving back in, that type of thing. It's just something I think we're going to end up living with. And, just a comment, it was interesting. I don't know if this has happened anywhere else, because I actually haven't looked for a couple of days, but there were 760 cases of the flu at University of Michigan at the college this last week. So that's starting up. So just a comment, but thank you all. Thank you for the information, Carolyn.
All right. Any other commissioners? I don't want to Let me look again here. All right. All right. Well, thank you again, Ms. Baker, for your report, and we'll see you next time. Madam Clerk, we can move to the next item.
Item 2, communication from the Department of Health, Human and Veteran Services forwarding the report on the amount of medical insurance reimbursements collected, comparing the results from fiscal year 2019 through 2020 to fiscal year 2020 through 2021.
All right. Is Mr. Caparu here?
Yes, ma'am, I'm right here.
All right. Can you talk about this item for
Yes.
us? Thank you.
Okay. Everybody see it on the screen? Did we scroll down to the actual report? It should be landscaped. Could you scroll down to who's controlling the?
Would like me to put the report up?
Yes, ma'am.
1 second.
There we go. Thank you. What you have here is the our report. I know last year when we talked to Commissioner Colleen, in previous years we basically had showing 1 year, but now we're doing a comparative between the 2 years. So in reference to the divisions that received insurance, Medicare insurance, yeah, public health first. You see in 2020, last year, it was like maybe about 1,400 or 1,400. But this year, or the year that just ended, 343. So just basically a decrease of about 1,000. The FQHC, that was an increase. Now that increase directly correlates to collection. I remember maybe about a year ago, we had mentioned that the FQHC, they had ran into some billing issues, but they end up hiring a company to help with the collection of receivables. Those receivables came in last year. And that's what that note is at the bottom. It's probably kind of small, but the note basically said the increase for FY20 is due to receiving 2 years of Medicaid reimbursement, FY19 and 20, following the submission of the Medicare cost report. So that's why that stands out, is just collection of previous reimbursements. And then the juvenile assessment, the JAC, there's a decrease also of about 406,000. So the decrease is still correlates to the reduction in seeing people in person due
We lost you. You still there?
to the pandemic. And I think
Okay. We lost you. Can you repeat your last statement?
oh no, I just said that's the end of my report. Any questions or comments for clarity?
Okay. All right. Commissioner Colleen.
Thank you, Madam Chair. And yes, Mr. Kepru, we did have that discussion earlier. Now I'm going to go just a little bit more. The reason we get this report, Mr. Kepru, is that when we have somebody in our custody and they need medical care outside of a county facility, that unless that individual has Medicaid, the cost of that care falls on the county. So a few years ago, we made a big push to get as many people signed up for Medicaid to come into our custody to reduce that cost, and it certainly has. And I note your note at the bottom that it's $4.5 million that have been redirected that used to come out of the county pocket that Medicaid is paying for. So we're looking at now, because you did the 2 years, and thank you. What would we have been paying out 3, 4, 5 years ago, Mr. Kepro, just to get a picture as to how much this has really decreased over time.
Ooh, I know the last report I looked at, somewhere between 7 and 10 million. It was a large number. I have to go back to give you an accurate number, but it was definitely, it doubled. It would have been double this.
Yeah, that's what I thought is so out of the county's pocket before we really started getting people signed up for Medicaid when they come in. That's what my recollection is too, a $6-7 million
Oh,
a year
yes, sir.
item.
Yeah.
Yeah. And so if you could just, the next time you report this, go back a little further, just so people can see over time, what, this is why this is why we asked for the report when we first started signing people up for Medicaid, is to see what that difference is. And of course, the big difference came in the first couple of years. But, if you can just in your next report, go back a little further in time, just with a number to say, this is what we used to pay before we did this. Because if you haven't been on the commission in a while, you may not know why we're receiving this report and what it's telling us. So thank you for the report, sir.
No problem. And so
Yeah.
I want to make sure I'm clear. So in reference to the jail part, to know that at the bottom, go back a couple more years so we can just see what it was a few years ago and how it trended down.
Yeah. And
Gotcha.
so we can see also the effect of the policy, and getting more people signed up, and they probably get better care. So,
Yes, sir.
yeah,
Gotcha.
Yep. Thank you. And thank you, Madam Chair.
And thank you, Vice Chair Colleen. Any other commissioners have questions? All right, is there a motion to approve this item?
Move to receive and file, Madam Chair.
Support Anderson.
It's been moved and supported. Can we get a voice vote, please?
Want a voice vote or a roll call vote?
Yeah, we could just get a voice vote. All those in favor? Yes.
Aye.
I didn't say that part. Yes. All right. Any opposed? Any abstentions? All right, there are none. Motion passed. Next item.
Item 3, communication from the Department of Health, Human and Veteran Services, forwarding report for the Youth Assistance Program's yearly outcome and program description for fiscal year 2020 through 2021 as compared to fiscal year 2019 through 2020.
All right, Ms. Baker, you're up again. Can you just talk to this item, please?
Hi, this is
I'll turn it over to Cecily Hogan from the Division of Juvenile Youth and Youth Services, Juvenile and Youth Services. Cecily.
Hi, this is Cecily Hoagland. I'm the administrator in the, let me see if I get my video on. Oops. Can't get my video on. So I'm Cecily Hoagland. I'm the administrator in the Juvenile Youth Service Division. And this is our youth assistance program. And it shows our outcomes for fiscal year 21 compared to fiscal year 20. So in fiscal year 21, we service 30% less youth than last fiscal year. Can you put the report up on the screen? Do you have the report in front of you?
There it is.
Yes, she's pulling it, moving through it. Mhm.
So we can go down to the charts. You know, and yeah, participants are referred to the YAP programs through the school system, through community-based organizations, through churches, through police agencies. And the schools were closed all of last fiscal year. And a lot of the churches and community-based organizations were also closed. And schools just started going back in September of 21. So we think that accounts for the low number of participants.
Okay.
In addition, we also included each agency, each YAP agency, and the number of youth they served, and their percentage, number of kids that completed the program.
Great, great. Just to clarify, we only pay for each participant. Is that correct?
We pay for the services. For each service, there's a unit cost. So it's a fee for service. So if they're not in the program, then they don't charge us, and we don't pay for that. We only pay for the kids that are in the program based on the number of units of service they receive.
All right, thank you. Commissioner Colleen?
Thank you, Madam Chair, and thank you for the report, Ms. Hoagland. I'm going to kind of ask you a similar question to what I did with Mr. Kepru a minute ago. I do understand from your report why we have fewer kids this year, right? COVID affects everything. But going back 20 years when the county took over juvenile justice from the state of Michigan, and how much we have improved things for the kids and for the citizens since the county has taken this over. Juvenile justice in Wayne County is definitely a success story. But can you go back a little further than fiscal year 1920 to see, if you go back 4 or 5 years, how many kids would we have had in the YAP program? Because I'm looking at diversions, and I would think, of course, the last year you're reporting here, 2021 is an odd year because of COVID. But have we been increasing the number of kids in the YAP program and diverting them out of the juvenile detention facilities? So if we go back 4 or 5 years, how many kids would have been involved in the YAP program, and just round numbers?
I know in fiscal year 19, I think it was like 900 kids. And fiscal year 18 was a little higher than that. I would have to go back and check our historical data.
Yeah.
And I could provide that information to the committee tomorrow or the next day.
Yeah, because I think that'd be a good perspective to have in what we're trying to do and what you guys are doing in juvenile justice, to see what the trend lines are over time for the number of kids, because judges assign them to the youth assistance programs, don't they?
Some judges, well, it's really the prosecutor's office.
The prosecutor's office, yeah.
Yes.
Sorry. So to get the sense of how many more kids over time, last 5-7 years, are being diverted out of the juvenile detention facility and other criminal justice programs, and that the prosecutor is putting them in here, just in terms of tracking this program and its effectiveness, that it would help me understand things a little better, to know what the trend lines are for the number of kids that are going into YAP, with the exception of the COVID year.
Yeah, the last 2 years.
Which changes everything, but a little longer view of the data, not that much, maybe just one graph. This is how it's changed over time, is another measurement for me as a policymaker for understanding how well we're actually doing this. So I would appreciate that.
Yeah,
Thank you.
I can look that up.
Thank you, Madam Chair, and thank you, Ms. Hoagland.
You're welcome.
Thank you. Any other commissioners have any questions? All right.
Move to receive and file, Madam Chair.
Support
Thank you.
Anderson.
All right, and we will do a voice vote. All those in favor?
Aye.
Aye.
Any opposed? Any abstentions? All right, motion passed. Next item, please.
Item 4, requesting commission approval of amendment 2 to a 3-year contract with 2 one-year options to renew with house arrest services.
All right. Is there any questions about this item? Any commissioners have questions? All right, is there a
Move to-
motion?
Yeah, move to approve this item, Madam Chair. Colleen.
All right.
Support, Ready.
All right, it's been moved and supported. Let's have a roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. Anyone opposed? Any abstentions? Motion passed. Next item, please.
F, such other matters as may be properly submitted before the committee.
There are no such other matters. Next item.
Public comments.
All right, does anyone in the public have a comment? If you do, just to let you know, we don't respond. We just listen to your comments. Any public comments?
The hand
And it
raised.
looks like
Ms. Schultz.
Mr. Schultz, go right ahead.
I'm a female. That's an IE for my first name.
Okay.
Um,
My apologies, yes. Mhm.
How much
That's
time, Madam Chair?
okay. According to the
Chair, I'm sorry, how much time for public comments?
2 minutes.
Thank you.
Mhm.
according to the CDC, children 5 to 14 years old have a 0.2 chance of dying of COVID. Yet from all deaths, suicide is 1.5, homicide is 0.7, cardiac disease is 0.6, drownings are 0.5, and the flu and pneumonia are ahead of COVID-19 deaths at 0.3. We, as parents and legal guardians of these minor children, do not want vaccine clinics in our schools. Medical decisions need to be left up to us parents, not to the government. Unmask our kids and leave our babies alone. I do not co-parent with the government. Stop these mandates and stop driving us to a communist state. Thank you.
Thank you. Mr. Let's see, Robert.
Thank you, Commissioner. Good afternoon, everyone. Robert
Mhm.
Blosky here, calling in from Southgate, Wayne County. Just like to chime in on the vaccine numbers, and I'd like to chime in on one thing. I like what you're doing with the vaccines, but the problem is let people have a choice when it comes to these vaccine numbers. I get your goal is to get the numbers raised to the goal that you want, but that's not helping the fact that you're forcing vaccines on students and parents and seniors. If seniors want to get the vaccine, that's their choice. If students want to get the vaccine, that's their choice. If parents or any other adult wants to get the vaccine, that is their choice. Me, I'm not getting the vaccine for one reason. One, it's my choice. Two, there's so much science behind it. I don't think it's safe. And I don't think people know it because of the lies that the media is pushing so far at this point. Like I said last meeting, you have my respect. You know, you do a lot for Wayne County and our municipalities and how much work you put in and all, the time and energy it takes, for a commission like this, to make decisions, that are best fit for the community. Like I said, you have my respect, but all I ask is don't push vaccines on people unless it's their decision to make it. I'm coming out of this as, calm, unlike most people. Most people nowadays, they take this and they take a little aggression to it. I'm taking it, as calm as I can be, because this frustrates me very much. And I don't need to have our state come into a communism state. But just please don't force things on people unless it's their choice and they choose to get it. But I'd like to chime in on Commissioner Monique's point earlier. Have a wonderful Thanksgiving and eat good. But thank you so much for the time and opportunity to speak.
Thank you. Any other comments? Any other public comments? Any emails, Madam Clerk?
No emails.
Okay. And I don't see any other hands, so. All right, we will move to the next item then.
Adjournment.
Is there a motion?
Support.
All right, it's been moved and supported. All right, we'll see each other next time. Thank you.
Giving, everyone.
All right.
Take care, everyone.
Yes.